Ready for a deep dive into a topic that's, well, let's be honest, a little bit scary.
Scary, yes, but incredibly important.
Exactly. We're talking about meningitis and encephalitis. Serious stuff. Infections that affect the brain.
And those can have some, well, pretty serious consequences if they're not caught and treated early on.
Which is why we're here,
Yeah.
to break it all down.
Exactly. Knowledge is power, right?
Absolutely. So when I hear meningitis, I immediately think fever, headache, stiff neck, that classic trio.
Right. Ingrained in our minds.
It's like the universal warning sign, isn't it?
You'd think so, but it's actually less common than you might expect. Less than half of meningitis cases actually present that way.
Really? Wow, I had no idea. See, this is why we do these deep dives. Okay, so if those classic signs aren't always a sure thing, what should we be on the lookout for?
You want to look for at least 2 of these 4 symptoms. Neck stiffness, definitely. Fever, of course. Altered mental status. Any confusion or disorientation, that's a big one. And then that persistent headache. Any 2 of those together, it's time to see a doctor.
Okay, got it. 2 out of those 4, red flag. So let's say those symptoms do show up. What's actually going on in the body? What's the root of the problem?
Well, it's not just one single villain, unfortunately. We're talking about a whole range of infectious agents.
Like what? Give us the rundown.
Bacteria like Listeria, for one. You can get that from contaminated food. Then there are viruses like HSV, which most people associate with cold sores, believe it or not, but it can actually affect the brain, too.
Wow, I never knew that.
And then we also have some fungal infections that can lead to these conditions.
It's amazing how all these different agents, from bacteria to fungi, can have such a targeted impact on the brain. It really shows how interconnected everything is.
It really does. And the thing is, vaccination has significantly changed the landscape.
For the better, I'm assuming?
Oh, absolutely. What used to be a major threat, certain types of bacterial meningitis, for example, those are far less common now thanks to vaccines.
That's good news.
Yeah.
But I imagine there are still challenges, right?
Always. As one threat diminishes, another one seems to emerge. It's the nature of infectious diseases.
So what are some of the curveballs doctors are seeing these days when it comes to meningitis and encephalitis?
One of the biggest is the rise of healthcare-associated infections. Infections that are acquired in a hospital or healthcare setting.
Oh, I see.
These can be trickier to treat because the bacteria involved are often more resistant to the standard antibiotics.
That makes sense. Hospitals are dealing with so many different pathogens. It's like a breeding ground for tougher, more resistant strains.
Exactly.
So it's not just about knowing the symptoms, but also about understanding the context.
Absolutely. And that's where a thorough medical history comes in handy. Where you've been, what you've been exposed to, it all plays a role.
Which makes me think about the speed at which doctors need to act when someone shows signs of these infections. From the research, it seems like every minute counts.
You're right. With meningitis and encephalitis, you can't wait for all the test results to come back before you start treatment. You have to move quickly.
But how do doctors even know where to begin if they don't have a specific diagnosis yet?
It's a judgment call, for sure. They have to consider the patient's age, their medical history, any potential risk factors. And they have to factor in local patterns of antibiotic resistance, too. It's about making the most informed decision you can with the information you have at that moment.
So it's a bit of a balancing act for doctors. They need to start treatment as quickly as possible, but they also don't always have all the information right away.
Exactly. It's about weighing the risks and benefits and making the best call you can in the moment.
And sometimes that means using steroids early on in treatment, which seems counterintuitive at first glance.
Yeah, you'd think you'd want the immune system firing on all cylinders to fight off an infection, right?
Exactly. Isn't that what steroids are supposed to suppress? The immune response.
Well, it's a bit more nuanced than that. While we do want to fight off the infection, we also have to think about the brain's response to that infection.
What do you mean?
Meningitis in particular can trigger a massive inflammatory response in the brain. And that inflammation itself can be incredibly damaging.
So it's like a double-edged sword. The infection is a threat, but so is the body's own response to it.
Exactly. And that's where steroids like dexamethasone come in. Studies have shown that when dexamethasone is given early on, it can actually help prevent some of the long-term complications of meningitis.
Like what kind of complications?
Things like hearing loss, neurological problems, cognitive impairment. It's all about minimizing the collateral damage of this intense battle happening in the brain.
So it's about finding that balance, right? Fighting the infection, but also protecting the brain from its own immune response?
Exactly, and that can be a tricky balance to strike.
For sure. So we've got the antibiotics going after the infection itself, and we've got the steroids helping to modulate the brain's response. But There's another layer to this whole thing that I found fascinating. The blood-brain barrier.
Ah, yes. The blood-brain barrier, one of the brain's most impressive defense mechanisms.
It sounds like something straight out of a sci-fi movie.
Oh.
Tell me more.
So the blood-brain barrier acts like this super selective filter.
Mm-hmm.
It controls which molecules can pass from the bloodstream into the brain
And that's important
for protecting the brain from all sorts of harmful substances, toxins, pathogens, you name it. It's essential for maintaining a stable environment for the brain to function properly.
But I'm guessing it also poses a challenge when we're trying to treat infections like meningitis and encephalitis.
You got it. Getting medications past that barrier can be tricky. It's one of the reasons why these infections can be so difficult to treat.
Because even if you have an effective antibiotic, it still has to reach the site of the infection, which isn't always easy.
Precisely. And this is especially true with those healthcare-associated infections we talked about earlier.
Because the bacteria are already more resistant to antibiotics to begin with.
Exactly. It's like trying to solve a puzzle within a puzzle.
So what can doctors do?
They have to be very strategic about their antibiotic selection. They need to choose antibiotics that have the best chance of crossing the blood-brain barrier, and then they have to monitor the patient's response very closely.
It's a delicate dance, for sure. And it's not just about fighting the infection itself. It's also about managing the potential complications.
Absolutely. There are a lot of things that can go wrong when you're talking about an infection of the brain.
One of the things that jumped out at me during my research was the risk of brain swelling. Intracranial hypertension is the technical term, right?
That's right. And it's a very serious complication. When the brain swells, it increases the pressure inside the skull, which can lead to all sorts of problems.
Like what? What kind of damage are we talking about? Like what kind of damage are we talking about?
Seizures, brain damage, even death in some cases.
That's terrifying.
Yeah.
So how do doctors even begin to manage that? What can they do to combat that kind of swelling?
Well, there are a few tools they can use. Sometimes they'll use what's called a ventricular drain.
What is that?
It's basically a small tube that's inserted into the brain to drain off excess cerebrospinal fluid.
Ah, so it's like relieving the pressure by creating more space.
Exactly. Another option is medication to try to reduce the swelling itself.
Okay, so it's about buying the brain time to heal.
Precisely. Give it a chance to recover without causing further damage.
You know, I remember reading about cases where doctors have used induced hypothermia for severe brain swelling, essentially cooling the body down to a lower temperature. Was that just a medical fad, or was there a real promise there?
It's an interesting example, actually, of how medical thinking changes over time.
How so?
Well, induced hypothermia was a big deal for a while. The idea was that by cooling the brain down, you could slow down its metabolism and reduce the risk of further injury.
Yeah, makes sense in theory. Kind of like hitting the pause button.
Exactly. But large-scale trials, unfortunately, show that it wasn't as effective as we'd hoped.
And not only that, but I think I remember reading that in some cases, it might have even been harmful.
That's right. So a good reminder that even with the best intentions, we don't always get it right the first time.
Absolutely. Trial and error, it's how we learn.
Yeah.
So, as we wrap up our deep dive on meningitis and encephalitis, what would you say is the most crucial thing for our listeners to take away from all of this?
I think it boils down to awareness, really.
Awareness of...
Of the signs and symptoms, of course, but also awareness that those classic signs we talked about, the fever, the headache, the stiff neck, those aren't always present.
Right. We learned that the hard way. Less than 50%.
Exactly. And even beyond the symptoms, just awareness that early detection and treatment are absolutely critical with these infections.
Absolutely. And knowing your own risk factors too, right?
Right.
Like if you've recently been hospitalized or if you have a weakened immune system, those kinds of things.
All of that. Being your own advocate, having those conversations with your doctor, asking questions, that's all part of being aware.
It's about connecting those dots, right?
Yeah.
Between your medical history, your current health, any potential exposures you might have had.
Exactly. It all ties together.
So to leave our listeners with a final thought, something to ponder. We've talked about how the landscape of these infections is always shifting, always changing, with new threats emerging and antibiotic resistance on the rise. What does the future hold? What's next in the fight against meningitis and encephalitis?
It's a million-dollar question, isn't it?
It really is.
And the exciting thing is, there are a lot of brilliant minds working on it. Researchers are exploring new ways to deliver antibiotics directly to the brain, for example, bypassing the blood-brain barrier altogether. And then there are therapies that target the body's inflammatory response with much greater precision, minimizing those harmful side effects.
Wow. So it sounds like we're on the verge of a new frontier in brain infection treatment.
I think so. We're learning more every day. As we unravel the complexities of the brain, I have no doubt that we'll find even better ways to protect it from these serious infections. It's just a matter of time.
That's hopeful. And on that note, that's all the time we have for today's deep dive on meningitis and encephalitis.
A pleasure as always.
But remember, knowledge is power. So stay curious, stay informed, and as always, if you have any concerns about your health, don't hesitate to reach out to your doctor. Until next time.